Good morning, everyone. Today is Thursday, August 10th. Thank you so much for joining into our weekly healthcare reform webinars. We do have some new folks on the call today, so I wanted to take a few minutes and introduce myself. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. My duties include overseeing the group health markets as well as what is left of the individual health markets in the state of Pennsylvania. There are a number of ways that you can ask questions during this webinar. One of them is you can click on your hand icon, which is on the control panel to the right of your screen, or you can type in questions in the question box and I'll answer those at the end of the webinar. This webinar is geared towards the under 65 market. Some of the items for your Medicare markets and over 65 might have, some similar rulings or a cause and effect sort of ruling on the Medicare segment. But again, what my focus is on the under 65 market. So that's really the purpose of these webinars and not Medicare. So let's just jump right into it. Just with a show of hands quickly, if you can let me know if you can see my screen and hear me okay. Awesome, perfect, thank you. All right, so let's just jump right into it. There is, I thought there wasn't a whole lot happening and then all of a sudden there is. So a lot coming down the pike in the next week or so. So a report is being bandied about that the Senate Health Committee will begin bipartisan hearings in early September. They're going to work on stabilizing and strengthening the Affordable Care Act individual insurance market. That's going to be headed up by Republican Chairman Lamar Alexander and Democrat Patty Murray. So basically what they're going to talk about, certainly on the docket, would be the cost share reductions, those payments. Senator McConnell does say that the repeal and replace is still, there is still a chance. So what comes of those meetings in early September has yet to be determined, obviously, but we'll be watching very closely. Speaking of cost share reductions, this is a big sticking point for these insurance carriers, trying to price for the stability of their plans for 2018. And the payments are being dangled. And, I'm certainly not advocating or crying for any insurance carrier out there. I'm just letting you know that these the cost share reductions are going to have a huge effect on the rates that we'll end up with in 2018. The next payment of these cost share reductions is due on August 21st. So, that's coming up soon, and we'll certainly find out what's going to happen, hopefully by September. In the rate filings we're talking about right now, Kaiser looked at, I believe, 10 major cities or 20 major cities, and they're reporting that rate increases or rate filings are anywhere from 5% increase, which is in Providence, Rhode Island, to a 49% increase in Wilmington, Delaware. So, with final rates due on 8/16, I mean, that's Wednesday. That's less than a week away, and we're still in this, volatile market, and contractual signatures for participation on the marketplace from the carriers are due on September 27th. So again, we're coming down to crunch time, and there's still so much uncertainty. I just don't know what we're going to be left with. In September, another decision will be made to continue funding for community groups to assist with the FF enrollment. The community groups were given $63 million to more than 100 community groups in 2016. These can be reviewed annually, and termination of the funding can happen, and it's based on performance. So that's going to be interesting what this current administration will do with that funding. There's also a lot of talk now of Medicare expansion. So Senate Democrats introduced a Medicare Expansion at Age 55 Act. It's called the Medicare at 55 Act, and it's backed by Democrats, introduced by Senator Debbie Stabenow from Michigan. So this is very interesting. It's going to allow Americans age 55 to 64 to purchase Medicare coverage. It doesn't make Medicare universal, of course, and you know, part of the thought process is that it gets the oldest and sickest out of the individual market segment, and hopefully would have some sort of effect on the stabilization of the individual market for the under 65 folks. So we'll see what happens, but there's also a plan that in September, House Democrats plan to introduce a Medicare Buy-in and Healthcare Stabilization Act, and that would allow Americans 50 or older to buy into Medicare for as little as about $8,200 a year. They go on to say that a 60-year-old gold plan right now costs over $13,000, so a buy-in to Medicare for, you know, for as young as 50 would actually save. You know, so again, it's been bantied about before, even before the Affordable Care Act was signed, but you know, this is certainly going to be introduced. How much teeth it has, I'm not sure. You know, right now in the fiscal year of 2016, 42% of all federal program expenditures were spent on the Medicare program. The trust fund is supposed to run out, depleted on 2028 or 2029, depending on what you read. So is it a solution? Possibly, but does it cause more issues budget-wise and everything else? Possibly. So again, we'll keep watching that and let you know what we hear, but a lot of action going on. Speaking of the FFM, that was just released last week, so I'm not sure how many are going to continue to do the certification. You know, I do think that there's not going to be a lot of changes. Now, I don't know this from conversations with any insurance carrier, but I don't think that the whole commission model is going to change much. So that leads me to believe that at least renewals may have some little, at least stipend paid. So if you do want your renewals, it is important for you to do your certification. If you need your password reset, the number is there, 855-267-1515. The individual 2018 refresher course is preloaded for you if you've done testing in the past. And if not, there are also instructions that I included this week as well as last week on how to get in and do that certification if you've not done that before. Next bullet point is CBC Group Renewals. We're still having problems. They have changed the way that they're going to be emailing the clients the renewals, but there are still problems within their system. So if you are missing any of your renewals for 11/1, please let us know. We will track them down from Capital and get those to you. Capital also has, you know, opioid abuse has certainly been in the news. And it's a huge problem, obviously, in America, probably worldwide as well. But because of that, carriers really are starting to, you know, kind of restrict and watch what is being prescribed and the quantities. So the opioid prescriptions with Capital will have new quantity level limits and daily dosage limits. The limits are in effect now for off-exchange members and will apply to exchange members starting January of 18. There is prior auth that's needed, prescription justification. The prior authorization is now also going to be required for oral fentanyl, methadone, medicated assisted treatments like Suboxone, et cetera. So, you know, I applaud what these carriers are doing. It is a big problem. And I just want you to be mindful of it. And just a further note, there is a change to the Capital Blue Cross group application, so that is on our site. But just of note, groups with capital coverage within the past 12 months who are terminated delinquent are now required to pay their past due balance prior to a new setup. This is effective with groups applying for a 1/1/18 effective date. So again, be mindful of that. If your new business specialist comes back to you and says that the group is going to be rejected unless they pay X amount of money, then you know, obviously you're aware of it. August 16th, which is next Wednesday, Central Pennsylvania Association of Health Underwriters is having a CE seminar. There are still some seats available. It is a 2 CE seminar. There is going to be an ERISA presentation talking, you know, obviously about ERISA requirements, summary of plan documents, etc. And then there's also going to be from Cigna a self-funding 101 segment. So hopefully you can join us. It's 8 to 11:30. There is breakfast that will be served, and it's being held here at URL. The following week, August 23rd, URL is having a seminar. PrimePay, Lisa Collins from PrimePay is coming in and doing a 2 CE seminar on the top 10 items to review for healthcare reform compliance. Again, very timely. If you want to see the syllabus before you commit, it is a free seminar, but if you want to see that syllabus before you commit your time, let me know and I will email that over to you so you can make a decision. There's also been a change to our Medicare Connections and Leaders Conference agenda. The Medicare Connections conference is still the all-day conference on Wednesday, September 6th. However, the Leaders Conference is now changed to, it's going to end after lunch. So we're only going to have the morning sessions. We thought that was just much better during this time of year to not tie people up for 2 full days. So again, Medicare Connections on September 6th is an all-day event. The Leaders Conference is on the 7th, and it will start with breakfast and then your breakout sessions, and then it will end after lunch. Hopefully you can make it. There's a lot of carriers there. I personally have Geisinger, Capital, and Highmark coming in to talk about what to expect in 2018 and their strategy and what their plans are in light of this volatility with the legislation. So again, if you have some time, it is absolutely free, and it's at the Hershey Lodge. I would encourage you to attend. And that's it. That brings us up to our open forum, and hopefully there's some questions this week. And again, if you have any questions, certainly you can bring them to me offline as well. That it always benefits when we hear them out loud and we all learn from each other's questions. I certainly have a lot of questions myself, and don't pretend to know everything. So if I get a question that I can't answer, it's always helpful for me as well, you know, to research that answer and learn something new. So I'm going to open it up for questions, and just as a reminder, next week on Thursday the 17th, I'll be back here at 9:30 for our weekly webinar. So let's just see these questions. Pam says, just confirming, if we want to be paid for our renewals, individual and group, we must do the FFM certification, correct? Question mark. Yes, Pam, that is correct. The SHOP is a separate certification for the groups. That SHOP, you just need that agreement. In fact, I can show you that agreement here. You can, the SHOP, the privacy and security agreement is still the only thing that is required. There is a different way to submit SHOP groups this year, much more similar to how it was at the beginning, where we're dealing directly with a carrier. I'm not sure if that will help with the commission payments because they seem to be very elusive. But again, the answer to your question, Pam, is yes, you must certify if you are going to be paid any renewals. Dave says, Cap Blue Cross Producer Summit General Sessions on 8/24. Yes, there is a general session that is being held in the afternoon, and that was sent directly from Capital. And he also asked, why would SHOP be good? Well, SHOP sometimes has, and who knows what's going to happen in 18, but SHOP has different plan options. So, and again, the small business tax credit is only available for SHOP. So whether it's good or not, I don't know, but I can tell you the process is probably going to be a little bit easier this year than, the last couple of years. Hope that helps. All right, that is the end of our questions. And as always, I truly appreciate everyone joining in. Keep your questions coming. If any of the handouts that are on the control panel you can't access, just shoot me an email, debw@urlinsgroup.com, and I'll shoot those over to you. Thanks again for attending, and I wish all of you a very wonderful balance of the week and a beautiful weekend. Bye-bye.